all, including calcium, magnesium, and phosphate. ECG, chest X-ray, blood gas, urine drug screen ASAP, and... The nurse cut in from the bedside. Pulse is 140, pressure 260 on 140, respiratory rate of 28, and temperature of 38.4. There was a pause as she fiddled with the oxygen saturation probe that kept slipping off Laura's jerking finger. Oxygen saturation is sitting at 88%. Not a normal vital sign in the bunch. Sugar? I asked. Glucometer was normal at the scene, the scrawny paramedic piped up. Damn, gone was the most rectifiable cause of a seizure, low blood sugar. I edged closer to my patient. The mingled odors of vomit and urine assaulted me, forcing me to breathe through my mouth. Lara's hair had fallen back from her face, and I could see beyond the strands of drool and blood. The flickering eyelids and gnashing jaw belonged to the face of a child, someone who had no business being near after-hours clubs and their inevitable cache of designer drugs. I felt familiar stirrings. Fucking junk, I wanted to shout. I glanced at the clock. 5 minutes since arrival, 25 minutes since onset, and the seizure showed no sign of lessening. The drool at her mouth had begun to bubble and became a rich froth like an exploding soda pop can. As I reached for my stethoscope, my worry meter crept higher. Another 4 of lorazepam, and hang a dilantin drip. Run in a gram over 15 minutes, I said, calling for the heavy artillery of anti-seizure drugs. Pulling the stethoscope off my shoulders, I leaned over Lara's jerking form and raced through a head-to-toe physical exam. Filled with fluid, her lungs were all gurgles and wheezes. A bluish tinge enveloped her fingers and lips. I glanced at the monitor. Her oxygen saturation had dipped into the 70s, respiratory failure territory, and her blood pressure had risen even higher. We have to stop this seizure, now! That meant medically paralyzing the young girl. I recited the drugs and sequence I wanted them given. Dr. Dafoe, you better look at this. Jan waved an ECG printout at me like it was a flag. I studied the 12 squiggly lines, stunned by their implication. A heart attack? At 14? She must have cocaine on board, too. I looked to the respiratory technician. Everything ready? She nodded and pointed shakily to the tray beside me. Okay, Anne, give her 100 of sucks. Anne stuck a syringe into one of the 4 IV lines leading into Lara's arms. She pushed on the plunger. Within seconds of administering the succinylcholine, a fast-acting drug that paralyzes muscles and renders patients into ragdolls, the twitching began to subside. Soon, Lara lay still on the bed. As expected, she stopped breathing. What I didn't foresee, but should have, was the fountain of foam spewing from her mouth as her lungs passively expelled their fluid contents. I grabbed for the scythe-shaped laryngoscope. The knuckles of my left hand ached, and I glanced down at the source, the healing, jagged gash from my bike chain that ran across my knuckles like a jailhouse tattoo. Ignoring the pain, I clicked open the laryngoscope's blade and eased it into Lara's mouth, pushing her tongue out of the way. To pass the endotracheal tube into her windpipe, I needed to see her vocal cords, but I couldn't visualize anything through the froth. I stuck a suction catheter in her mouth, but it was as hopeless as trying to vacuum up water from a burst and still spewing pipe. The monitor's alarm screamed, warning me what I already knew. Lara's oxygen level was dangerously low. "Bag her," I said to the respiratory technician, who fumbled to cover Lara's mouth with the clear face mask and pump oxygen in with a balloon-shaped ambubag. I turned to Anne. "I have to do this retrograde." Anne's eyes betrayed her skepticism as she reached for the retrograde intubation kit. Her doubt was well-founded, too. It was a technically challenging procedure at the best of times, and I was firmly perched on the wing-and-a-prayer side of the statistical success curve. I took a long, deep breath and willed my hands to steady. I reached for the open tray Anne held out for me. Setting it on the bedside, I scoured through it until I found the syringe with a long, ominous attached needle. I slid an index finger along Lara's soft, damp neck until I felt it dip into the groove of her cricothyroid membrane. The alarm throbbed in my ears. With a slight tremor, I aimed the needle, directing it slightly upward for the skin over the cricothyroid membrane. I held my breath as the needle pierced the skin.